The consultation is done on the first visit, and it's an opportunity for the doctor to get to know exactly why the patient has decided to choose chiropractic care. During the consultation, we're finding out what the main or chief complaint is and all the effects that that has had on their life. We like to know, for example, when did the complaint start? How bad is it from 1 to 10? What makes it better? What makes it worse? Have they had it ever before? Is there a family history of this sort of problem? What other complaints are there that are similar or different from the complaints that are brought them to the office? We like to know as much as we can about the patient during that first visit so we can better tune our examination to help us understand exactly what's going on. An examination at Keenen Chiropractic is where we determine exactly the cause of a person's problems. And we normally start with the patient lying down on their stomach. At that point we can palpate or check each of the vertebrae to see which ones are out of alignment or if there is a problem with the muscles and identify just generally the condition of the spine. We can also test muscle function, and you'll see here that we're actually testing the strength of the muscles. When we ask the person to sit up, we're determining whether or not the body is in good enough shape that the core muscle strength is there. We can also do tests to determine whether or not the body's muscles are functioning properly. And we do this by applying pressure on the muscles while the body's being held in different positions. And this very quickly helps us to determine what's going on. Other tests that we might do might include reflex testing. We might also employ standard equipment such as the blood pressure cuff to determine if that person's blood pressure was within the normal range. All these tests help us get a clearer picture of what is going on with the patient.